Hello, my name is Dr. John Miller, and I serve as the editor-in-chief for Psychiatric Times. And I'm really excited to be here live at the annual American Society of Clinical Psychopharmacology conference. And one of my favorite sessions at these conferences is a review of pipeline medications. And remarkably, there are 2 hours of time, and there are 12 drugs, and each presenter gets 10 minutes to introduce the drug, talk about mechanism of action, talk about the current clinical data, and talk about their future planning. So pretty remarkable. But I'm going to be even faster than them. So the first drug that was presented, it was interesting, and it's called Luvesilocin. And it's basically an analog of psilocybin that is metabolized to an analog of psilocin, which is the active ingredient of psilocybin. And they're studying it as a one-time dose to treat postpartum depression. And so it's yet another one of the large array of medications that are looking at the psilocybin-like drugs, the serotonin 2A receptor, as an agonist. And we'll see where that one goes. But they did a nice presentation and fascinating data. The next cluster is a whole new area, and one that you want to keep your eyes on. And that has to do with the HPA axis, the hippocampal adrenal pituitary axis. And basically, we know that the HPA has been really important with vasopressin and oxytocin and steroids and all the way back to the 1950s. Well, there were two separate studies being presented, and they were looking at subreceptors of the vasopressin receptor. So the first one looked at a drug that antagonizes the vasopressin receptor 1A, and it's specifically being studied in social anxiety disorder. And so the data looks really good. It's early, but we'll wait and see. And then the other drug, the vasopressin receptor V1B, is being studied looking at major depressive disorder. So, you have two, basically the same system, different subreceptors, one social anxiety and one major depression. So stay tuned for that. Another drug is a good friend of ours, ketamine, discovered, FDA approved in 1970. And ongoing research. And so the group that presented yesterday about ketamine are looking specifically at the use of ketamine in non-movement symptoms of patients with Parkinson's disease. So they're looking at all of the other emotional, functional, not related to movement, and have shown some pretty good data with durability. And so to stay tuned in and to be determined how that goes.